Gamblers often refer to the lucky 7 when rolling their die. With diabetes, you already have one strike against you, and that there are many diabetes-related complications that can occur. And as doctors, we like to think of those in two different arenas as microvascular or small vessel problems versus macrovascular or large vessel problems. And in the microvascular category, the main vessels with an elevated blood sugar that can be affected are those in your eyes, your kidneys, and your peripheral nerves. So there's certain little ways that we like to upkeep your health maintenance to make sure that those don't happen. In terms of the macrovascular complications that can happen, you're most at risk with elevated blood sugars to have heart disease, peripheral vascular disease, and stroke. And so, as physicians, we like to obviously ensure that these complications don't happen. So you should have a yearly dilated eye exam with an optometrist or an ophthalmologist who can screen for cataracts or glaucoma. In terms of the kidney disease, you should have a yearly urine microalbumin. Spillage of protein in your urine is the earliest marker of any kind of proteinuric renal disease or nephropathy. So we like to get that every year, or if you're on a medicine such as an ACE inhibitor that would end in Pril, or an ARB, which would end in something like Sartan, we could defer the test for over a year, but that's routine screening, is to get it once a year. In terms of screening for the feet, the next thing we look for is to do a yearly foot exam. And that involves us as physicians checking pulses and also checking for sensory deficits that would put you most at risk for diabetic foot ulcers. What happens with diabetes is that once you can't feel your feet and you can't feel that you have an ulcer, that's when things can get bad and lead to amputations, and that's what we're trying to prevent. We also tell patients that they should do a nightly foot check to make sure that any ulcerations are not happening. To prevent some of the macrovascular complications, there's certain numbers that we look for. That is your blood pressure. The current guidelines for blood pressure are that you are less than 140/90, and this should be checked at every doctor's visit. We also need to control your cholesterol levels, most especially your LDL cholesterol. There are two sets of guidelines that have been released. The newest set of guidelines say that we should have all diabetics on a high-intensity statin regardless of their number. And those high-intensity statins are atorvastatin or Lipitor or Crestor. And the other set of guidelines, which is older but is still well favored, is to have your LDL cholesterol less than 100. Then in terms of a screening tool, the next thing that patients with diabetes should be aware of is their A1C number. Now the A1C, it gives us a good guideline of what your blood sugar has been running for over 3 months. The hemoglobin A1C, what that means is hemoglobin is a red blood cell. It has a lifespan of about 3 months, and then it goes to the spleen, it's destroyed, and you make new ones. During the time it's alive, extra blood sugar can add on to that red blood cell, and the more sugar you have in your blood correlates with a higher hemoglobin A1C. So it gives us a snapshot in time of what your blood sugar has been over those 3 months. So in order to gain the best diabetic control, we like that number to be less than 7. The last thing is to have smoking cessation. So we all know that smoking is bad, but it's especially bad in diabetics because all of the things that they're predisposed to, smoking just ramps up the process, and it can lead to more accelerated problems with eyes, kidneys, peripheral nerves. So if anything, we congratulate the people that don't smoke, and if they do smoke, we absolutely insist that they quit smoking. So just to recap, the 7 things that the diabetics should be concerned about and want to monitor are to get their yearly eye exam, to get a yearly urine microalbumin, to get their physician to do a yearly foot exam, and to control their blood pressure to less than 140/90, their LDL less than 100, or to be on a high-intensity statin like Lipitor or Crestor, to have your A1C less than 7, and to quit smoking.